Hey guys, today we are going to talk about head injuries in toddlers. So a few years ago, I attended a family pool party before going to work in the emergency department. And when I got there, one of my cousins came up and said that his daughter, who was young, preschool age at the time, had fallen off of a water slide ladder, and she had fallen maybe 6 feet or so and had hit the back of her head on cement. This happened maybe 15 minutes before I arrived there. By the time I looked at her, she was awake, but she just seemed kind of out of it. She was whimpering and sitting on her dad's lap. They think maybe she lost consciousness for a couple of seconds, but they weren't sure. She hadn't been vomiting. I checked the back of her head out, and she wasn't bleeding or anything, but did have a little bit of swelling just at the back of her head. And because of the way she looked, I decided to recommend that they go to the emergency department. They decided to take her to our closest emergency department, and then a couple of hours later, I headed off to work. Now, I work in the only children's hospital in the region, and when I got to work, I saw on our board that we had a 2-year-old patient coming in from another hospital with a head injury. I checked, and sure enough, it was my cousin's daughter who was heading into our hospital. She ended up having some bleeding inside of her skull. She stayed a few days in the hospital. She vomited a couple of hours after the initial injury happened, but not right when it happened. And then after spending a few days in the hospital and then recovering at home, she made a complete recovery and she's doing well. So that was the good news to the story. I did want to talk today about some things that I think about or pay attention to when I decide whether or not a child needs to go to the emergency department or to a physician's office to be evaluated for a head injury. So toddlers have big heads, they fall down a lot. So how do you decide what is important? There are a few things that I look for. The first thing is whether or not they lost consciousness. I want to know if they cried right away or if they were out for a little while. That's important. The second thing I pay attention to is whether or not they had any vomiting. Was it one episode of vomiting? Have they had multiple episodes of vomiting? Has that calmed down and they've been able to eat? Those are important things to pay attention to. The next thing I want to know is, over time since their injury, have they been acting more like themselves? Maybe they had an initial period where they were crying and upset, but then maybe got distracted with some kids playing again or a popsicle, and now they're perking up and feeling more like themselves. Or have they been progressively getting more sleepy and tired and clingy since the injury happened? So these are some of the things that I think of. So I would say if your child lost consciousness, if they're acting like things are getting worse and not better, if they're acting really sleepy, then I do think they should be evaluated by a provider. Just because you go to the emergency department doesn't necessarily mean we are going to do anything different than watch your child. However, there are things that I think of that help me know whether or not I think a child needs a CAT scan or a CT scan. And a lot of those things are what I mentioned. Sometimes by the time parents bring their kids to the hospital, the kid looks great. They've perked up, they're smiling, they're happy. The parents feel a little frustrated, maybe a little sheepish that they've come to the emergency department. But I'm just grateful that they're looking better. And I encourage the parents to also look at it from this perspective, that the child is getting better. If they look okay, but they've had a pretty significant fall, I may decide to watch them for a little while. We know that from studies within about the first 4 hours, if something is seriously wrong, we will usually see the child take a turn for the worst in that first 4 hours. And so we may decide to say, why don't you just hang around in the emergency department? We'll get you a movie and some snacks, and we'll see how things are going around that 4-hour mark. And if things look good, you can go home. If, on the other hand, the child doesn't look great, they have kind of a significant enough story or history that makes us worried, we may go ahead and order that CT scan. And what we are looking for is something significant like a depressed skull fracture, so not just a crack, but something that may need intervention by a neurosurgeon. The other thing we're looking for is any bleeding with inside the brain, either the brain itself or inside the skull. We are not looking for concussion, so there is not a way to actually see concussion on CT scan, so that's a diagnosis we make clinically. And we are balancing our best decision with how we think your child looks based on the low risk but the real risk of using radiation. So hopefully those are some tips that help you know whether or not to take your child in for evaluation after they've had a fall when they're in that toddler preschool age range. And let me know if you have any questions. Thanks.